Okay, now we're on Tai Chi postures and traditional Chinese medicine. Lecture 8, slide 26. Grasp the sparrow's tail. The sparrow's tail is the section that we do, which is the Peng, Lu, Ji, On. So that sequence, you're using the whole body. You're shifting the weight to the back, shifting the weight to the forward. This posture, it promotes the stimulation to the lungs, large intestine, heart, pericardium, and triple warmer, the 6 hand-related channels, which can function as a release for the heart and a draining of the lungs of sick qi. So let's talk about the channels and where they are, because they're talking about the 6 channels of the hand. You have your yang side. Here's your xiao yang, triple burner. On the other side is the PC, pericardium in the middle, to the middle finger. Then you have your tai yin to the inside, to the thumb. Then you have your yang ming on the outer side here. Okay, kind of like yin and yang on this side. Then you have yin and yang on the other side, the xiao yin heart channel. And then the small intestine channel, tai yang. Okay, so you have those channels. So you're always changing, for example, from a xiao yin to a jui yin channel. Pericardium is jui yin. So continuing with the lecture, all this stuff, when you get the sick lung qi out, you're nourishing your heart and you're calming the mind. You're connecting with the qi of the earth through the bubbling well acupoint, the kidney 1 yang chuan point, and that plays a role in increasing the strength of the kidney channel. Single whip. This is the posture with the hook hand. Remember, we're connecting the 5, bending the wrist, hand, wave, turn over. As the waist turns left, the left kidney slightly sinks down and the right one slightly floats up. This soft motion is excellent for massaging the kidneys. This posture also exercises the stomach and urinary bladder and the Renmai and Dumai channels. Since the wrist is the spot where most meridians connect, the single whip wrist motion stimulates all the channels at the same time, which helps the healthy coordination of the total body function. So sometimes I'll say meridians or sometimes I'll say channels. They're both the same thing. The lift hands posture here. It benefits the heart, stomach, spleen, kidney, urinary bladder, gallbladder, and liver channels. Right crane spreads its wings. This one. The triple warmer meridian, and it adjusts the qi and blood circulation. It functions as cleansing for the liver and nourishing the lungs, strengthens the stomach and spleen, calms the mind. The motion in the feet and heels also stimulate the stomach and liver channels. The brush knee, this posture that we'll be doing. So we turn into that motion. This emphasizes the laogong in the center of the palm and the bubbling well acupoints. It stimulates the lung, heart, pericardium, and kidney channels. The ward-off monkey, we might not be able to get to this one. This is like a step back motion. In that motion, during that posture, one side of the waist steps backwards and you feel like it's floating upward, while on the other side the substantial step may feel like it's sinking down. The motion massages one's kidney and strengthens the kidney function and benefits the belt channel, the Ren and Dumai. It helps the circulation of qi and the blood circulation, so as to be helpful for balancing the body's total function. We're going to skip 30. Let's try to focus on some of the ones that we're doing. Cross hands. The opening and closing of the arms in large range of motion increases the oxygen intake by the heart and lungs, which also strengthen the meridians in the heart and lungs. Stepping solid on the bubbling well, acupoint increases the chi in the kidney meridian. This may efficiently increase the practitioner's vitality so as to prevent or heal problems with the heart, circulation, and breathing. In the closing of Tai Chi, we use the bubbling well, acupoints, stimulates the lung, large intestine, and kidney meridians. Okay, so let's clear the confusion about the word qi. In Tai Chi and Qigong, from a traditional Chinese medicine perspective, there's not just one qi, but there's many types of qi that become one. So the first one's called Wan qi. It's kind of like our genetic code, inherited by your parents, your reproductive hormones, your essence, jing, and kidney qi. Then there's the Kong qi, which is from the oxygen the quality of your body gets from the air you breathe. It's associated with the lung qi. The Gu qi, or the grain qi, is for proper dietary nutrition. That's where you get it from the food we eat. So the body needs to sustain homeostasis by way of the earth elements of the stomach and spleen. And then you have Zong qi. When Wan qi, Kong qi, and Gu qi all combine, they combine in the heart's blood to be distributed out to the body. There's a saying in Oriental medicine, you should actually eat first and then exercise second. This is because they think that the nutrients of the qi will go out to the four limbs. The spleen controls the muscles of the four limbs. Then there's Zen qi. This is the true qi of the chest, distributed out into the body from the heart and lungs. Then there's the yin qi, the nutritive qi that's inside the channels, the blood vessels. And then there's the wei qi, or the defensive qi, kind of like your immune system. It's the qi that's outside the channel. This is the one that when you do qigong or tai chi, this is the one you feel. You have that qi feeling, or in yoga they have a prana feeling. And then there's finally the zeng qi. This is actually used in talking about the health and wellness of the patient versus the pathogen. So you have your upright qi. When you are normal and you're working properly, you're in a state of health and balance with a strong wei qi, then your zhen qi is upright, it's good, it's clear. But then you can compare it to if your body's getting attacked by a pathogen, whether it's an external pathogenic factor or an internal pathogen. So it's just comparative to that. Okay, work on your homework. Start beginning to practice the form. I want you to work on that and keep your journaling going on. And this is the end of Lecture 8.